Finally, this is what I've been waiting for, the opportunity to apply my clinical knowledge to real-life situations on placement. But what if I'm tasked with something I'm not familiar with? And with the recent doctor strikes and understaffing, what if there's little to no supervision? What do I do in these situations? Can someone help me?
Fear not, James. I'm Guidance Guy, and I'm here to help you every step of the way with the power of my book created by the GMC called Achieving Good Medical Practice.
Wow, thank you, Guidance Guy. But how will you be able to help me?
I'm here to be your companion and guide you through your medical journey. The GMC Guidelines are like a magical map that will lead you in making the right decisions within your competency.
That sounds amazing. I'm really grateful for your help, Guidance Guy.
I have faith in you, James, but don't forget the principles of the GMC Guidance. They will steer you through any challenging situations, and if you need me, just say my name, Guidance Guy.
Good morning, I am Dr. Taylor, the consultant in the Accident and Emergency Department. We are really short-staffed today, so I need you to go and take some blood culture samples from Mr. Smith in room 203, whilst I deal with a medical emergency.
Of course, I would love to take some blood cultures. Thank you for the opportunity. Oh no, what have I done? I don't know how to take blood cultures. I know I should seize every opportunity on placement, but I think I've made a mistake here. What do I do? Someone help me, please.
Don't worry, James. I'm here to guide you. But first, let's assess how you came to be in this situation. Where's your ID badge? It's important to wear it at all times and to introduce yourself to patients, carers, and colleagues so that they're aware you're a medical student and not a registered doctor. This allows them to understand your level of competency so that they won't ask you to do anything you're not trained to do. So, James, do you know what are the 3 levels of competence?
Okay, Guidance Guy, let me see if I can remember the 3 levels of competence. From what I can remember, the first level of competence is working safely in a simulated environment. This means that me or another medical student will have not performed the procedure on a real patient during medical school, but on a simulated patient or a mannequin. That must mean that the second level of competence is working safely under indirect supervision, meaning that I would have a supervisor with me as I'm carrying out the procedure, and they would observe my practice to judge whether I'm safe to move on to the next level of competence, which is indirect supervision. This is when I've already achieved direct supervision, but my assessor or the supervisor believes that I have the necessary experience and skills that are sufficient for me to perform this procedure safely under indirect supervision.
That's correct, James. Well done. So now that we've addressed the 3 levels of competency, I want to ask you, what level of competency would you need to be at in order to obtain the blood culture samples safely?
Guidance Guy, I'm not sure, but because I haven't been trained in this procedure before, at this moment of time, I think that this procedure is beyond my level of competency. So in order for me to perform this procedure safely, I would need to have successfully completed all 3 levels of competency, working myself up from a simulated environment to direct supervision and then finally indirect supervision. This would mean that I would be able to take blood cultures at a satisfactory and safe level. But how can I expand the limits of competencies whilst on placement?
Well, James, in order to expand the limits of your competencies, it is important to attend all teaching sessions run by the medical school or your placement provider to ensure that your knowledge and professional skills are up to date. So now that we've covered these scenarios, I'd like you to put my guidance into action and resolve your current situation.
Hello, Dr. Taylor. I've forgotten to introduce myself correctly. My name is James, and I'm actually a 4th year medical student, and I've not yet been trained on how to obtain blood cultures in simulation or from patients under supervision.
Thank you for telling me, James. I will ask another member of staff who has been trained and is competent to take blood cultures to do the job. In the meantime, do you feel confident to go and clerk the patient in Bay 4 bed 1 by taking a history and then presenting back to me before I go and see the patient? We are short-staffed due to the doctor strikes, so this will help us out and help your learning.
Yeah, sure, I can do that. Good evening, Mr. Raymond. It's nice to meet you. My name is James Thompson and I'm a fourth year medical student. Today I've been asked to speak to you to see what's brought you into hospital today, and then I'll be feeding back this information from this conversation to the doctors who will be in charge of your care. Is this okay with you?
Hello, James. Yes, that sounds fine with me.
Thank you. So before I begin, please can I confirm your full name and date of birth?
Yes, James. My full name is Jamil Raymond, and my date of birth is the 1st of July, 1954.
Thank you very much for speaking with me today. It has helped my learning quite a lot. I will now go and feed back the information that I've obtained from this conversation to my supervisor, who will be looking after you today. Do you have any questions for me before I go?
Yes, doctor. I have one question. Do you know what's actually wrong with me?
Let me take a step back for a second. How should I answer this patient's question? During our conversation, I've made a good list of differentials and I have a basic plan in my head. But should I share this with the patient before speaking with the doctor? Guidance guy, can you help me?
Don't worry, James. You did the right thing. You recognized the limits of your competence and asked for help. It's normal for patients to ask you questions regarding their condition and management, or generally questions you may not know the answers to. It is always important that the information we give patients is accurate. So in this situation, what you should do is gently remind them of your role and encourage them to ask questions regarding their care to the medical team that is looking after them, as this is currently beyond your level of training at the moment.
Hi, sorry Mr. Raymond, I was just taking a few moments to gather my thoughts. Unfortunately, as I am just a medical student, I will not be able to answer that question in particular, but what I will do is speak to the doctors in charge of your care and get them to answer this for you. And if you would like, I would get them to come down and talk to you to answer any other questions you may have to ensure that you get the right answers.
Okay, thank you very much, James.
Okay, James, it seems that you've had a very busy day of placement today, but I have 3 questions for you to check your understanding of my guidance. So the first question I'd like to ask is, what are the limits of a medical student's competence?
Yes, guidance guy, indeed, it's been a very busy day at placement today. To answer your question, I believe that the limits of a medical student's competence are defined by the level of training, knowledge and experience. From what you helped me to remember, there are 3 levels of competency. The first is being able to safely practice in a simulated environment, then practicing under direct supervision, and lastly, safely practicing under indirect supervision. Medical students should always ask for advice and help when they are unsure of how to carry out any procedures on placement or about anything in particular, as patient safety is always the number 1 priority.
Second question is, what can a medical student do on placements and what can they not do?
That's a good question, guidance guy. As medical students, we often fixate on things that we can't do on placement and don't realise the things that we can do. We should always be aware of any restrictions that are put in place that restrict certain activities by both our medical school and the placement provider. We should always take responsibility for our own learning and seek opportunities as and when they appear, but if we did not feel confident, seek appropriate supervision. We can interact with patients on wards, take histories, perform examinations, but we shouldn't answer questions that we do not know the answer to and refer the patient to the senior medical staff. We should engage fully with the scheduled and opportunistic bedside teaching to ensure that our knowledge and skills are kept up to date.
Excellent, James. And now for my final question. Under what sort of circumstances might a student be asked to work beyond their limits of competence, and how should they respond?
As students, we might be asked to work beyond the limits of our competence in robust, busy environments such as the A&E, or even where there's less staff members to supervise us, such as during out-of-hours work, during emergency situations, or during periods of understaffing such as in the strike action by any NHS personnel. Students should respond by remembering to work within their scope of competency at all times, and guidance is published by their medical school or placement providers to ensure patient safety is not compromised.
It appears you're on the right path, James, but now I must depart. But should you ever need me, you can always find my teachings in the GMC's Achieving Good Medical Practice Guidance for Medical Students online.